We include a lot of single leg work in the later stages of our longevity and lifestyle knee program, and that's for good reason. Firstly, it's really important to think about your ability to tolerate the demands of day-to-day life. Now, most of the time, you would spend with 2 feet on the floor. However, every time you walk, you have 1 foot in the air for a moment in time. Now, things like falls and falls risk go up as we age. So in our foundation program and even into our longevity program, those of you that are of an age where falling over and hitting the ground isn't too pleasant and it runs a high risk, typically those falls happen when we get unstable. Either we lose our footing or our footing gets crossed over. So we're walking along talking to a person beside us and we trip on something and our legs get crossed over. Now, when the legs get crossed over, what needs to happen next is we need to quickly respond and stabilize on one leg to catch ourselves. If you can't do that, then the ground will catch you, basically. So there is a major factor for including single leg exercises into our knee programs. Our number one objective with the knee program is to allow you to take control of your movement in your life so that you can go out and do things you want without fear of pain and discomfort and irritation. What we want to make sure is that when you go out and you start engaging in things that you love doing and getting outdoors and playing with your kids and your grandkids and so forth, that you don't run the risk of going over because you're a lot stronger but you're unstable. And that happens when you always focus on 2 leg exercises. If you have a wider base of support, if these are my feet, if the base of support is out here, the feet are wider, it's like a pyramid. It's much more stable. You can express more strength because you don't have to overcome the instability. The limiting factor is your strength, not your control and your balance and your stability. What we want to make sure is that the limiting factor is your control and your stability, so you get stronger in relation to your ability to control the position when on one leg or when with a narrowed base of support or a narrowed stance. That's really important to us in the knee program, that your stability improves concurrently with your strength. We don't want one to go up without the other. So that's why we include loads of single leg work. In the runway to single leg work, in the programs like foundations and longevity in the early stages, we typically focus on narrower basis of support. So instead of having your feet hip width apart, we bring them in narrower together, or we put 1 foot in front of the other, or we stand in a lunge position. But just mixing up the foot position takes away some of the stability that wider stances give you. So if you can't do the single leg work, that's okay, but as long as you're progressing or on a progression line towards it, that's what matters the most.